Welcome to a couple of Rad Techs podcast where we bring you an inside look at the world of radiology from the unique perspective of a married couple of radiologic technologists. Together, we have years of experience, exactly 30 years in the field, and we are here to demystify the science of medical imaging. Radiology is the unsung hero of the medical field, providing doctors with crucial images and information that help diagnose and treat illnesses. Join us as we explore the latest techniques, technologies, and innovations in radiology and discover the vital role we play in the healthcare industry. So come along for the ride as we share our passion for radiology as a married couple. Welcome everyone to our series on breast cancer awareness. This is our final series. I am so sad this is our final series, but that's okay because we are going to keep it going and we're going to have a good conversation. Our guest today has been on this podcast before. And first, let me introduce myself. I am Chaundria Singleton. I'm a radiologic technologist first and foremost, 21 years in the field. I'm registered and certified by the ARRT in MRI, CT, X-ray, and nationally certified in mammography. Hence, I'm wearing all this pink. And my guest today is Chalonda Jones Thomas. I'm just going to give a brief overview and let Chalonda tell you all about her. She owns she's the CEO of the Thomas Institute of Health Professions. And I love to make sure I plug that because she has tons of experience in the field, but she's giving back to our field by helping and educating professionals in the radiology industry. She has registry prep, structured education, continuing education. She is just amazing. And get this, she has 100% pass rate. So I don't think anybody else can say that. So, if you're looking for a school to get that registry, you want to up your game in your profession, you want to up your paycheck, look at the Thomas Institute of Health Professions. And Chalonda, thank you for being here on our podcast again.
Thank you, Chaundria. Yeah, I enjoy that you have decided to do a series on breast cancer and breast cancer awareness because that's a very important topic. I did my dissertation actually on breast cancer and breast cancer screening. And so I found it information that it hasn't gotten out there like it should. And I tried to find ways in which I personally can get out as a healthcare professional and spread the word and try to encourage the public to go and get screenings. Yeah, and so I didn't just say, so, it's just things that I found out over time. There's a lot of myths out there that have not been addressed. We addressed it.
We're going to get into that. We're going to get into those myths, you guys. So I want everybody to know who you are. So tell them just, briefly give them a little bit about your background, who you are, what it is that you do in our lovely field of radiology.
Okay. I am Chalonda Jones Thomas. I am a certified radiologic technologist. I'm also certified in CT. I'm certified in MRI. In my field, I am currently the CEO and president of Thomas Institute of Health Professions. I've been in the field for over 25 years. I began in the clinical side, and I became the supervisor for several years for diagnostic radiography. I then went into education, and I became the assistant professor, not only for the radiography program, but also I was the assistant professor and clinical director for nuclear medicine. And so I developed the first online CT MRI program, complete program through nuclear medicine. And so I am excited to be here and just share what I know, share my knowledge with you.
Well, we are happy to have you. So you guys, if you're watching live on LinkedIn or Instagram, welcome. And if you're watching the replay, welcome as also. And let us know in the comments where you guys are chiming in from, where you're chiming in from, and what questions you may have for our professional here. Again, we have over 40 years of experience on this panel right now, and we're going to be talking about some wonderful things. So I'm going to just briefly let you know the purpose of this series. And if you haven't caught up, this is series number 4, Breast Cancer Awareness. October is Breast Cancer Awareness Month. And it's just a month where we don't just wear pink. We actually bring awareness. And we're going to talk today about myths concerning breast cancer and breast cancer screening, perceived barriers, because that is one of the things, and she's going to talk very passionately about that because they are perceived barriers. There are no barriers to taking care of your breast health, men and women. And thirdly, we're going to talk about how medical imaging professionals can increase the awareness. So we hold a responsibility as well as technologists in the field. So we're going to talk about how we can do more for our patients and also for ourselves. We set the example, right? So Chalonda, let's kind of get into that. Myths concerning breast cancer and breast cancer screenings. How would you define breast cancer and, through your experience, the prevalence of it? Explain the prevalence of it.
So when we talk about the prevalence of breast cancer, there is a lot of myths concerning that. One of them is the statement that the African American women have a higher incidence of breast cancer. That is not true. Actually, Caucasian women have a higher incidence of breast cancer. We have a higher mortality rate of breast cancer. And so that's the difference. And so some of that comes from what I have discovered is the perceived barriers that I'm going to talk about in a few. But I want to make sure that I say that I was talking to someone on yesterday, actually, who asked the question, why do Black women get breast cancer more? And I had to correct them on that because it's not that we get it, African American women get it more. Some of it have to do with is we arrive to get treatment or to get exams later. So it's delayed. And so by the time we go and get checked, it already have progressed and spread it. So that is the difference between when we talk about the incidence of breast cancer
and that's a good,
and mortality rate. Yeah,
I like how you brought that up because that is a myth that I personally had. You've heard it, but I hadn't heard it that much. But I haven't worked in the breast memo field very long, and you have. So that's why we have you on here, because some of those things, and I love how you really cleared it up, that it's not so much, it's just that when we finally catch it. So we're going to talk some more about ways that you can find things earlier, why the month of October is so important when it comes to breast cancer screening. So when we talk about breast cancer, there are different types of breast cancers. It's just not one breast cancer. There are different types. Everybody is different. But the one thing that I appreciate is the associations that are out there. If you want to just know some general information on breast cancer is a type of cancer that begins in the cells of the breast. It can occur in both men and women, more commonly in women, but it can occur in both. And we've had doctors on that says the incidence of men having breast cancer is rising. So this is not a woman versus a man thing. It is both. And something that we should start early, helping people to understand your breast should be given just as much attention as your thyroid, as your fibroids, as, your ovaries. We have to give attention to the breast. And it's a leading cause of cancer-related deaths globally. So Chalonda has talked about that. And then when you take it to a cultural standpoint, you can prevent some things by making awareness of them as we are doing today. So go ahead and tell us some more myths maybe that you've heard and that you've run across in your experience. Hey, you guys, as a radiology technologist, I understand the ultimate task of radiology technologists to bring that coffee into their department every morning without spilling it. So I'm going to introduce you to Bevy. Bevy is perfect for this kind of occasion. If you've got the responsibility of bringing in that much needed coffee to your colleagues in a radiology department, have no fear. Bevy was designed just for us rad techs. It's a problem solver to carrying more beverages than your two hands can hold. This beverage carrier can hold up to 12 drinks securely spill-free, and fits perfectly in your car. You guys, no more spills, no more accidents. Bevy's innovative design keeps your drinks in place even during the most hectic mornings and as you're trying to carry everything in. And the best part, Bevy is proudly owned and operated by a woman. Join the growing community of satisfied Bevy users and experience the convenience and peace of mind you deserve, and your radiology coworkers do too. So don't let spills slow you down. Get your Bevy drink holder today. Keep your coffee and drinks secure before they get to the radiology department. Get 20% off too. Use my code RADTEX20.
Another one includes talking about the lumps in your breast. And so, of course, we need to pay more attention to our breasts, become more aware of our breasts by doing self-breast examinations. That is actually one of the main things, because you know your breast more than anybody else. Mm-hmm. So I want to make clear, yes, if we find a new lump or anything like that, we need to take heed of it. We need to pay attention to it. Also, pay attention to the changes in your breast tissue as well. So don't just look for a lump. Pay attention to your breast tissues as well. If you see any change in colors, that you should also, or lumps, you should go to the doctor and then get checked clinically. And so that's another myth, is if you find a lump, that's breast cancer. And that's not always breast cancer. It could be benign. But again, you still need to go and speak with your doctor and let your doctor clinically evaluate you. And before, you get to the point that you say, oh, okay, I have this lump, but I'm going to see how long it'll take for it to go away.
Yeah, and we do that.
That is not
we do that, right? I mean, and the healthcare workers, I'm gonna call us out here. We do that as well too. We'll say, "Oh, it's gonna go away. It's just a cyst," and then the cyst start turning into like a little shrimp in the inside, and it's like, wait, now it's got two more little tentacles going this way. You feel, and you just say, "Oh, it's gonna go away with my cycle. My next cycle, it'll go away." Because sometimes maybe the last one did, but this one isn't. We just ignore it. Oh, well, it doesn't hurt. I work in healthcare, or, I've had these kind of lumpy breasts all my life. And some women just don't know, or men don't know what their breasts feel like. So it's important to do those, early on. And one thing we talk about this series has been really helping people to understand what breast tissue is. So I want to kind of zero in on all the information you just gave us, because you gave us a lot of good information there in that second myth. But when you talk about lump in the breast, can you remind everybody, what is breast tissue? Because most people think it's just what fits in your bra cup, right?
Mm-hmm.
But
so breast tissue is tissue that is located in your chest area. And so when we talk about breast tissue, a lot of times we bring to another myth. When we talk about men, they got to realize they have breast tissue as well. And so your breast tissue goes all the way back towards your lymph nodes in your chest areas. So again, we just have to be careful. To your areola area is included in your breast tissue. And so we just have to make sure that we do self checks in our breast.
And one thing that people may say, well, I just don't want to do that. But it takes how long to do a self-breast exam?
It takes no time to do a self-breast exam. And you can do it while you're taking a shower. A lot of people go to take a shower and examine their breast. Again, I think a lot of it comes from a lot of myths. And just to talk about men in general, I not too long, 2 days ago actually, found out a male member of my family, have breast cancer, and he delayed it, and so it have now spread it. But it goes back again. We kind of look at our breasts and we say, "Oh, it's just a lump." And then you look at it, you say, you hope it'll go away, and you have a history of it he had a history of having this, and then he was going to a dermatologist. But he noticed after a while, this one did not go away. And so again, just being aware, being self-aware of your body, men and women, and realizing men get breast cancer as well. So actually, when you talk about men and breast cancer, one of the things I like to stress is, although the number of men that get breast cancer is low, the American, I think it's like American Cancer Society says around 2,000. This year they think about 2,710 cases of male getting breast cancer. Of those 2,710 cases, around about 530 deaths.
Wow.
So when we look at that, that's a high percent of that smaller number. So again, a lot of that has to do with males, again, saying, I'm a male and I don't get breast cancer, or, we're going to see, is it going to go away?
Right.
And so, again, just, I think, we as healthcare professionals need to bring greater awareness to males as well about breast cancer and breast cancer screening. Because last year I did a segment for the community, and I had some guys to get up, some males to get up and say, oh, they was kind of joking, but it was serious. They're like, oh, this is for y'all ladies. And they got up and left. We'll give her the lead. I said, no, I beg you differ.
Yeah.
I have information for you too. But, they had questions because, again, they didn't realize how many males die from breast cancer, just like females. And then, again, when we talk about the comparison of male to female, because the percentage is smaller, that means that it's more serious, because that means more men out of that population that have breast cancer now are dying compared to the amount of women.
So what do you think are the barriers that we talk about? Barriers when it comes to, there are no barriers. So perceived barriers. And it's probably different for men and women when it comes to breast cancer, because men is like, oh my goodness, I got breast cancer. That's a woman's disease, and they might be ashamed to go into a mammography center and schedule their yearly breast exams. Most men feel like, if I got breast, something's wrong with me. But a lot of men have breast. I mean, I do 21 years, almost probably half of my patients males, especially older, now younger, they have breast. They have breast. I mean, and for various reasons, some people take medications, some people just genetically have more breast tissue. And then some, as you get older, sometimes you just have more breast. It's nothing to be ashamed of. No. That could be a perceived barrier. Can you think of any other perceived barriers that men may face? And then maybe some we could give the women so they can get beyond that, because we need to go beyond, because there are no barriers when it comes to your breast health. Yes.
And you brought a great point about aging. So family history, because another perceived barrier is nobody in my family, have breast cancer. So therefore, I don't have a concern about breast cancer, because we don't have a history of breast cancer. And they don't realize that sometimes, especially in males, and that's what my cousin found out, like in the male population, there's several risk factors you have to consider. One of those have to be, it can be inherited. We call it BCCA2 gene. We also have a syndrome called Klinefelter syndrome, and it affects about 1 in 1,000 men a year. And that's when a male usually have a Y chromosome plus an X, but in this case, they have 2 or more X chromosomes. And so just a genetic makeup, guys can go and get, when they, another risk factor is like when guys have prostate cancer
Mm-hmm.
and getting radiation for prostate cancer. So that could increase their risk as well. Perceived barriers, insurance. The perceived barrier with insurance, people say, I can't go and get screening because I don't have the insurance. And so there's a lot of free exams, mammograms, companies that will come out. A lot of time they come in a mobile vehicle, mobile van, and can do the mammograms for free. But I think awareness, again, needs to be there that these services do exist. So that's a perceived barrier. Another perceived barrier that I have come across is the perceived barrier that, I just don't want to get the mammogram because the mammogram hurt. So I had it one time, and this coming from my research. I had the mammogram one time. I'm never going to do it again.
Yep.
And I'm like, okay, why you not going to do it again? I don't want to do it again because it scared me. It hurt. And that's where we can come in as professionals, and explain it to them. And actually, I had a mammogram, and I always tell them my experience, So, for example, now the mammograms compressions are not as tight as they used to be because our technology has advanced. And so the last time I had it, which was 2 weeks ago, I was like, that's it, because it wasn't a tight pressure like it usually be. Because I had 3D, they did 3D mammogram on me. So just kind of educating them. Another one I just heard when to speak somewhere was, well, my breast is too big for me to have a mammogram. And so my question was, why do you think your breast is too big? She's like, because the last time I had a mammogram, they when they did my mammogram, they had to do several images. And she said that all her breasts couldn't fit on the plate. But again,
we do it in quadrants.
Yeah, we do it in quadrants. And so I told her, again, it's important that you get mammograms done. We are specialists. So we by you not getting it done is where you put yourself at risk.
Yeah.
About not getting the mammogram done.
Well, Jen, not to interrupt you, but we got Instagram comments coming in here. We got people saying they were surprised as well that it wasn't as painful when they got it done. Vivian WS38 said that. And this is a young single mom. She was like, I was surprised as well that it wasn't painful. So just to what you just said, people are realizing, hey, it's not like what people scared me to think. So I can go back for the next one.
Exactly. Another perceived barrier has been distance. So before my research, I learned that distance is not really a barrier.
Yeah.
And because the population, I did a rural population versus urban population. So although the rural population, they have to travel, they said anywhere from 30 minutes to 45 minutes to get their mammogram done. When I found out, it really wasn't a perceived barrier. It really wasn't a barrier because what was happening is they had transportation to pick them up and carry them to a facility to get their exams done. The problem was they did not participate in the mammogram.
Oh.
So I heard that a lot. They was like, that's not a problem with us. The problem is not that we don't have a way to get our mammograms. The problem is people are not participating in the mammograms.
When you say not participating, what do you mean?
They're not going to get it.
That's what I thought you. I'm like,
yeah. So they said that. So what it is, a larger institution had got a grant. And so they had drivers to come to the rural area, pick them up. They said probably 4 or 5 people participated in the whole month. But they said that they'll come and it was their station to pick them up and then carry them back home after the mammograms. Some people said, so they was aware of it because it came up in my interview. The problem was that some people said that, they came too early. It was too early in the morning. We got back too late at night. And so they didn't participate, you know. And so, again, that was a perceived barrier, I thought, And so it proved me incorrect. And so I learned also with the urban women in my study that they actually said that they just didn't go. Mm-hmm. It might be 8 minutes. It could be 8 minutes away. It was the shortest distance between the mammogram and their resident was like 8 minutes. And you still had people not going to get their mammograms. One thing they said was myth as well was mammograms causes breast cancer.
Yeah. Touch on that, but we got a comment on Instagram. Someone said a myth that they heard is that if you don't have any pain or issues, it must mean all is well when it comes to the lump.
I'm that guessing. Came up too.
Yeah. What would you say about that? Thank you, Vivia WS for that 38 for that myth. Are you looking for an easy way to incorporate more fruits and vegetables into your diet? Look no further than Juice Plus. Juice Plus offers a convenient solution to help you eat more plant-based foods every day. Their fruit and vegetable capsules contain a blend of plant powders that provide essential nutrients, vitamins, and antioxidants from 30 different fruits, vegetables, and berries. Whether you're a busy professional, a student on the go, or simply looking to make healthier choices, Juice Plus can help you get the daily nutrients you need to feel your best. And the best part is, get this, Juice Plus is backed by extensive research, including numerous clinical studies that show the benefits of their products. Plus, they're committed to sustainability and use only the highest quality ingredients. So if you're ready to start eating more plants without the hassle of chopping and cooking, give Juice Plus a try. And if you place your order through my personal link in the description, you're going to receive 5 tart cherry complete energy bars as a thank you. So go ahead and order your fruit and vegetable capsules today. Now let's get back to our regularly scheduled program.
Yes, I heard that myth several times. They were like, well, they have the attitude. It was like the attitude of, if I don't feel anything, nothing going on, I don't have nothing to worry about. Mm-hmm. So they related to, if I don't have any pain, I'm okay.
Yeah, even if you have this big lump growing.
Yes,
yeah. And we've seen it. So, we've seen it, you guys. I mean, I have had patients that literally had a whole nother breast coming out. And they were like, well, it doesn't hurt.
Exactly.
And it's like, that's a problem.
But I think it's fear. I think it's fear.
That's just what I was going to say.
Because you said to yourself, I can't have breast cancer. It got to be something else going on. I can't have breast cancer. So I think it's a lot with the fear of saying to yourself, it's growing, but it may be just, it can't be cancerous because this can't happen to me. My mama didn't have it. My family didn't have it. So I can't have it.
And Vivia said something here too. The myth is you can be too young to get breast cancer.
Exactly.
People think they're too young, but I've had patients as young as 19 with breast cancer.
So, and that came up in the research too, was I had a lady, that child was 14 and she had breast cancer. The child came to her and told her that she was having leakage from her breast. And so she went to the doctor, and the doctors told her that she couldn't have breast cancer because she's too young to have breast cancer. This is actually what the doctor told her. but that parent were more persistent. Like, no, and it's an African-American child. She's like, no, this is not normal. My child shouldn't be leaking,
Right.
And so she's like, after going back and forth with this doctor, she's like, I'm gonna go and get a second opinion and go. And because she said the doctor didn't even do any kind of exam her, right? So she's like, she went to another doctor. Of course, she had breast cancer. But it was caught in time because now she is 40-some years old.
Ooh, I love it. I love it.
With 2 children. So, but I faced pushback from a doctor, and I'm in my 40s, almost 50.
Oh yeah.
And I had a doctor to ask me, so I asked him. I said, I told him, I said, I want to get my mammogram. So I had changed doctors. I was like, I need to get my mammogram. And he said, why?
Because I said so.
No, but my answer, I guess, was so higher up. He asked me, was I a doctor? Right. Because I gave him stats. I'm like, do you know African-American women? I went that with him. But you asked me why, and I was like concerned. I'm like, but this is sad because everybody do not advocate for themselves.
Yeah.
And so they kind of do what the doctor says. And a lot of times, if you don't know, that you should really start, if you're not having any problems before then, but at least at 40, start getting your mammograms. Yeah.
I think it's in a 30. I had a doctor on last week, and you have to go back and look, but even younger than that, they're recommending, and of course, doing your own breast exams and being cognizant of your breast, just like that 14-year-old girl was cognizant enough of how her breast, what they do and what they don't do on a regular basis. Everybody should know, your son should know, your daughter should know as a young age that they should be looking over themselves to make sure things don't change, because things do change as you get older. Things start to look a little different as you get older. But if you're not aware, and estrogen hormones change stuff, like life changes you. So you really have to be aware, and you're worth it. And I want to talk more to the technologists, because that's what we are. As a technologist, I get the exams done myself. You talked about the research you've done in the field, urban and rural, city research has been done, and everybody has fear. I don't care if you live in a rural, if you live in the city, the urban, you're fearful of, if I go get this test done, they might find something. Everybody has that fear. Very few people are like, yep, I'm going to go, and it's going to, you always have something in the back of your head that's like, if they find something, how am I going to live with it? How am I going to deal with it? I might have little small children at home. I'm taking care of my parents. I can't afford to be sick right now. I've just bought a new house. Like, all of those things go through people's mind. Like, I got a trip planned. Let me go on this cruise first, and then I'll go ahead and get my mammogram done. All of those things are not reasons to put off your breast exam. The month of October is here to bring awareness. If you have to do every October, that is the time that you get your breast exam done, go ahead and do it. Book them up. It's enough places out there that, make them not have any appointments in October, you guys. And I think as technologists, we can do a better job at the facilities that I've worked at personally of bringing awareness leading up to that month and even after that month with our patients that we know are breast cancer survivors, really rallying them to come back to the facility, to maybe give a seminar that month at the facility, maybe holding a big potluck, or, having somebody cater food trucks in a parking lot or something with pink balloons really around the month of October, one day in October, just to kind of thank your patients for coming in and getting their yearly mammograms, offer. So it's just, we can do more. When the patients come in as technologists, really calling our family up and saying, hey, do y'all know what the month of October is? Have you gotten your mammogram? Have you done your self-breast exam? Let's go as women in the family and let's go have a mammogram party. Something like that. What are some tips that technologists, in your opinion, can do to really bring awareness?
Some things I have done and continues to do every year. I have a community event. So I actually do it through my church. And so I have a community event where I do a big to-do, basically, encourage people to come out. I have different healthcare facilities to participate in the community, and we have a mammogram truck out there. where they can go and get their mammograms done. So I kind of, as a imaging professional, I go and I talk about mammography, talk about breast cancer screening, what it looks like, breast cancer. And so we kind of talk about that. And then, the truck is out there, the van is out there for them to go and get their exams done. Another thing you can do as imaging professionals, wear this pink. So when I went to get my exam done, I had my pink shirt on, I had my pink shoes on, and I went in there. I had a lot of conversations from my shoes. It started.
We got to see those shoes. Are they blinged out?
Yeah, they're right there. But yeah, so that everybody like, I love those shoes. And then I'm like, oh yeah, I'm going to get my mammogram today. And then that's how we started the conversation. And so just bringing awareness to the community. That is another way. I know a lot of times we say that the community at large don't understand what we do.
Yeah.
And one of the ways we as technologists can improve that is there's so many awareness that we can be involved in spreading the word, because we are very intelligent group of people. And so as a profession, so we can always go out there. We can encourage people for February, for example. We're talking about the heart. We have cardiologists, people work in cardiac.
Yeah.
So there's so many ways that we can bring information to the community. We don't have to wait until the community become a patient.
Yeah.
We can do it. We can be proactive.
Say that again. We don't have to wait to say that one more time, because that went by me kind of quick.
We do not have to wait until our community become our patient.
Well, Vivian just said amen to that. I agree. It's very simple, but it's very profound. Because we see people over and over and over. I have similar patients come in for an MRI, for a CT, but they live in there. And it breaks your heart. It breaks your heart. But like you just made really good points. Radiology is in every facet of healthcare. Cardiology. Any problem you have, you're probably going to have to come to some kind of imaging modality to get it diagnosed, get better detail, or follow through. You're always going to come to imaging. So we do play a vital role. And people really listen to us. I find my patients they really do listen to They might still think we're the nurses, but they really, even when they figure out we're not.
Actually, they call me doctor at my church.
Oh, girl, yeah.
They're like, I'm not a medical doctor.
Right. Yes, always putting you in the head. Don't tell people you work in the healthcare at your Bible study or nothing, because you're going to be the one doing the CPR classes. You're going to be doing. I do.
And I think that's why. But I love it. I prefer them to get the information. We just had a conference. And so I had a lot of participants from the church to come. And so the speaker came from the university, and she was speaking, and they was answering the questions. She's like, wow, you all are so knowledgeable.
Yeah.
And they're like, doctor over there told us about it. So they know I'm not a doctor. They just call me doctor.
Oh, yeah, girl, people can call you. They going to call you whatever they want to once they have it in their mind. But it shows the people, we do more than push buttons. We see a lot because everything has to come to radiology. Literally, Everything has to come to us. If Chalonda and I could probably sit down, we would blow your mind at some of the facilities we've worked at, some of the things we've been a part of, from research to, litigation to education to regular outpatient cancer centers. There are so many things that we are involved in radiology, and I would dare to say experts in. You have PAs out there. We have radiologist assistants. They're just like PAs, so
exactly.
we are, and many of us the doctors standing beside us doing procedures and going, hey, do you think I need this French or that French, or should I go a little further in? And I just had a radiologist on, and she's like, we really train our technologists to be our eyes. And I worked with musculoskeletal for years and literally sat in the reading room with radiologists. Those old school radiologists, they're going to train you. I don't know about the new ones because I don't really work in healthcare like that anymore, like I used to. But back in the day, those old radiologists, you're in a dark room in the reading room with them. They're explaining to you how they read and how they want you to understand how they read, because then you can give better quality imaging if you understand their process of reading. And there is a process to it. Like, radiology is just so fascinating to me. I'm grateful I got into the field, and it has allowed me to really get up and close with patients. And we're not hands off. We're not just there pushing people along. So we want you guys to ask any questions, really reach out to your technologist. The next time you go get any imaging service done, talk with them. You'll be surprised at all the information we can help you with, and some questions that we can legally answer for you. But Chalonda, I want to end off with this because we always have a good conversation. Chalonda and I can go on and talk and talk and talk. So we're going to do a whole big panel one day. We just need to do a whole big panel conversation because we could just talk. But what would you say in closing would be some key takeaways for our guest today, ending out this month, because the month of October is closing out, but we don't want it to close out on breast health? What are some takeaways people can remember, key things?
Just to take time, know your body. You're not too busy. A lot of times we say we're too busy to go and take care of our own selves. And we are not too busy to take care of ourselves. We need to schedule out like we schedule like anything else and take care of ourselves. Take care not only of ourselves, but the people around us. Spread awareness about breast cancer. Also, just basic things. People feel like they have no control over getting cancer, period. Not only breast cancer, this cancer, period. And one of the things I tell them, you can take time to love yourself. And some things you can do is eat healthier, is watch your weight, your diet, or whatever, exercise. Go out and take a 30-minute walk. It's hard for me to.
Yeah.
Because I get up every morning, I'm like, I don't feel like going. But take a 30-minute walk. And actually, not only good for your body, it's good for your mental as well.
Yeah.
And try to decrease, of course, if you're drinking a lot of alcohol, decrease that as well. There's nothing wrong, but we're having fun every once in a while, but just kind of limit what you're putting into your body and be more mindful of what you're putting into your body.
And that stress. Manage that stress as best as possible. Yeah. Manage that stress.
And walking exercise actually reduces
it. It helps. Yeah. I'm not a morning exerciser, but I will do it, but I don't like to get out of bed. So just to get out of bed is my exercise, but I will exercise later on. I just love the conversations, especially as women, that we have. I do want to thank you so much for being so willing to be a guest on the podcast and share all of your experiences, your knowledge, and just being down to earth and having regular conversations with people, because my Instagram is lighting up and they're really enjoying just a regular conversation. And I think that's some of what we can do as technologists and medical professions.
I was going to say that too.
Yeah.
And a lot of times I've had the community tell me, like, you explained it. I didn't understand it, but you explained it very plain.
Yeah.
And we don't want to talk too above people's head. We want to make sure, it's not, talking big words and speaking big words, that's not doing nothing but satisfying me. Yep. But actually my satisfaction comes from helping people make sure they understand and getting what they need to better their health. So again, I'm just me.
Yep. And that's the best way to be. So the audience loved it. And thank you again. And thank you all for your comments in the chat for the live video. And thank you for everyone listening to the replay of the podcast and the live. We appreciate your time, and take the time for yourself, if you have not already, to go ahead and schedule your mammogram, your breast ultrasound, your breast MRI, whatever it is your doctor has told you to get. And if they haven't told you, go ahead and set an appointment with a breast doctor, your family doctor. They can even do exams on you just to kind of get you started. You don't have to have a breast doctor, but that is I think you should have a breast doctor, in my opinion. It's like not having a cardiologist and you got a heart problem.
Exactly.
I mean, that's just how I look at it. It was the best thing I could have done, getting a breast doctor. I was like, whoa, this is a whole new world up in here. I mean, the experience of the mammogram was just out of this world. I'm like, coffee, tea, croissants. Oh my goodness. But it's just, you should be pampered during that time. And then when you make your appointment, grab a friend, grab a family member, grab a coworker, grab a neighbor. There may be an older lady on your street that lives alone. When was the last time she had a mammogram? Go knock on her door and ask. There may be some lady you see at the grocery store, a man you see at the grocery store all the time. Take the time to share this month of October and spread breast health awareness. We all can do it. And we're going to close out with that. And thank you again. And until next time, you guys, have a good evening.
All right. Bye-bye.
I hope you enjoyed this podcast today. Thank you so much for listening. This is just one of the many free resources I offer to my clients to dump unhealthy habits and begin living. Be sure to visit my website for more free resources and health coaching. Again, thank you for listening. Be sure to subscribe, leave a review, and share this podcast with others so they can join the Let's Chit Chat podcast. Have a great day, you guys. See you next episode.